Uh, Good afternoon, Mayor and council members. My name's Jason Balling. I'm here to provide the latest update on COVID-19 and some of the recent information and news we got last week and over the weekend. Uh, Dr. Christopher Urbina, our medical officer, is joining me. Deb Feddersfield, our deputy director, Helene Lanzer, who oversees community and nursing, and Ashley Anderson's filling in for Sarah Mock, and Ashley does all the data information for us, so we're glad to have her. The other thing is we have our city manager's office on the line, and we're going to be running this a little bit differently because we've invited members of the public to join us and to be able to ask questions. So I'm going to go through the slides and the information, and then I'll open it up to questions from council members. Use the same function if you could just raise your hand and I'll call on you. At the same time, when I do that, for those of you that are joining us online in the Zoom call from the public, you can also use the question and answer function to chatting your questions. And then our experts that are joining me will be able to answer them real time. And if there are some questions that we need to flag for an answer that has to go to all of council, we'll make sure we do that as well. So we're gonna try this format, see how it goes, and hopefully get through everybody's questions. So thanks, Jake, for teeing it up. And if we could go to the next slide. So I know there's a lot of information that came out from the CDC last week, from the State Health Department, even from ourselves in Broomfield. And I'm sure there are a lot of questions in the public, and I totally understand that. We're dealing with a novel virus that is mutating, and the science and the literature continually evolves. And here in Broomfield Public Health, we're gonna continue to follow the data, the science, and the literature as we always have. And more importantly, be very transparent with the public of what data we're using. So some of the key messages I wanted to highlight, given everything that's been shared over the last week, is one thing that we know is the vaccines are still highly effective. They reduce hospitalizations and they reduce deaths, especially if you're fully vaccinated. I have to tell everybody out there, the single most important step we could take to get past this virus is to get vaccinated. And I strongly recommend anybody out there that's still maybe on the fence, deciding whether or not it's the right time to get the vaccine. Talk to a trusted family member, talk to your doctor, whatever you need to do to go through some of the questions you have to determine whether or not you want to move forward in getting the vaccine. But we do know that it's safe, it's effective, and it's our only chance of really getting past this. That being said, we have a new variant that's out and new research coming out on the variant that's changed the game. It's the Delta variant. And as we know, it started and spread quickly, not only in Colorado, but across the nation. And we're seeing what's happening in some of the other states across the nation of how quickly it's spreading. We did issue a statement last week from Broomfield Public Health, and we recommended that the community wear masks in schools and indoor settings as an additional layer of mitigation. And I'm going to take you through the rationale of why we did that. We thought it was important to align with the CDC recommendation. I do want to mention, though, this is not a mandate or an order. We're informing the public of the potential risks that are out there and what they can do to better protect themselves, but also protect others. And then lastly, just where I stand as a public health director in Broomfield Public Health, we are cautious and we are watching the increasing case rates, but to be extremely clear, I'm not extremely worried at this point in time. We're going to continue to watch those severity metrics, such as hospitalizations and death rates. And that'll be our guiding factor if we need to make policy recommendations to the Board of Health. At this point in time, we're going to watch the case rates, see what's happening with transmission, but more importantly, focus in on what does that mean for our hospitalizations and deaths in the city and county of Broomfield, as we always have. So next slide, Jake. So some of the latest research that came out last week, and I've already addressed some of this, is vaccines are highly effective in preventing severe illness, hospitalizations, and deaths. They also reduce the spread of the virus in the communities. So some of the research that came out, and I read this over the weekend, is the risk of severe disease or death is reduced tenfold or greater if you're fully vaccinated. Your risk of infection is reduced threefold if you're vaccinated. And what we're seeing is virtually all hospitalizations and deaths continue to be among the unvaccinated. However, there was a lot of research that came out last week regarding the Delta variant, and it is different than the Alpha variant or the original strain of the virus that we were dealing with. It's much more contagious and possibly more severe. Well, we know it's more transmissible than MERS, SARS, Ebola, the common cold, seasonal flu, and smallpox. That's very concerning for us because we see that reproductive rate or number go up significantly from the 2 to 3 we were seeing before, potentially up to 9 to 10 people that can be infected from one person, which just means it can transmit more quickly in a community. We're also seeing that some vaccinated people can get the Delta variant, and it will result in a breakthrough infection and that they may be contagious. And this was the new key piece of information that drove the CDC and us in our decision making, and it was based on studies out of India and out of other countries, in addition to a study that was outbreak in Massachusetts, which we linked to. And what they found through that is that it's highly contagious, but more importantly, what they saw is in the specific outbreak in Massachusetts, the vast majority of people that came down with the virus there were vaccinated. So they saw a high number of breakthrough cases. And more importantly, what they saw is there was the same viral load, both in those that were vaccinated and unvaccinated, which then leads to the conclusion that this can be transmitted to others, even if you are vaccinated. And that's the big game changer information for us, is we have been saying, based on the Alpha variant, that masks were recommended but no longer needed because we believed if you were fully vaccinated, you couldn't, or it's very unlikely you would transmit it onto others. Now we have data to show that's not the case. We are also seeing that with the Delta variant, that vaccine effectiveness is decreasing among our vulnerable populations. So those that are immunocompromised and our nursing home residents. So the national data showed research and epi studies of outbreaks in nursing homes where the residents were fully vaccinated and we saw breakthrough cases. That also happened in Mesa County here in Colorado. And so that's very concerning for us because we know when we first entered into this pandemic, our nursing homes were some of our most vulnerable settings. So next slide, Jake. And all of you know this, but I just want to remind people who've gone over it before that breakthrough cases happen, and this happens with all vaccines, but we know no vaccine is 100% effective. And there's various reasons for that. I mean, obviously you have the host factors. We like to look at immunity across the whole population, but our individual immunity varies from person to person. The second thing that plays into this is potential waning immunity over time or how the virus changes. And so, as I've mentioned all along, the CDC is watching cohorts to see what this means for waning immunity. And the research they shared last week was based on how the virus has changed and impacts the vaccine effectiveness. What they're also finding is the vaccine breakthrough cases occur more frequently in those congregate settings and in groups that are at risk of reduced vaccine effectiveness. So those are our immunocompromised and our elderly population, again, some of those nursing home residents and others, and we list what immunocompromised is down below. If you do have a breakthrough infection, you may be symptomatic or you may be asymptomatic, and that's important for people to know, and hence why we were talking about this recommendation for masks. And then again, I just want to remind everybody, even though this is happening with the breakthrough infections, they're occurring in a small proportion of those who are fully vaccinated. So we're not talking about significant numbers here. We're talking about very low risk at this point in time. Next slide, Jake. But this does show what's happening as far as in the state with our vaccine effectiveness and the breakthrough cases. So what this table shows is the unvaccinated number of individuals versus our total number of cases and breaks it down into a percent. And what you can see from January 1st through July 24th is we weren't seeing nearly as many breakthrough cases, that the percent was extremely high as far as being able to prevent both cases, hospitalizations, and deaths. What we're seeing is those numbers are going down now, that we're seeing more and more breakthrough cases occur. But thankfully, we're not seeing it with hospitalizations and deaths. So we do anticipate, as more and more of our population is vaccinated, we'll see more breakthrough cases. But thankfully, it's not occurring within our specifically to hospitalizations and deaths. Next slide. And this just gives you an idea of the age distribution among vaccine breakthrough cases versus those vaccinated Coloradans. So what you can see with this is the light shaded is the percentage of that population that's been fully vaccinated. And then what you can see next to that with the dark shade is the number of breakthrough cases. And so we are seeing it in our 65 plus and in our 18 to 64 population, but not with our 12 to 17-year-old population. And Dr. Urbina and I and our team was thinking about it a little bit, and why we might be seeing more of those breakthrough cases within that 18 to 64-year-old population is, there's greater mobility, people that are working in essential services, and that could just lead to, again, additional exposure that could take place. Next slide. So the CDC, based on all of this information, decided that given that the vaccines are still very effective in preventing severe disease, but they're less effective at preventing infection or transmission, that there could be more breakthrough cases and potentially more community spread despite vaccination rates. And that's one thing that's playing out in Broomfield, which I'll show a little bit later. They also ran modeling data that shows vaccines, in addition to masks, are needed to curb the spread of the disease in a community with high transmission. So as you get to a place where you're starting to see your community transmission get in that high range, you want to really focus in on increasing vaccines. We know that's our way out of this, but at the same time, taking those additional mitigation efforts. It explains here that their ultimate recommendation in those areas of substantial and high transmission, they recommend that everyone fully vaccinated and unvaccinated wear a mask in public settings to prevent the spread of Delta and others. And the reason for that, it's so hard in these situations when you have a highly contagious virus of determining who's vaccinated or who's not vaccinated as you're going into these public settings. And the other rationale for that was, again, if you are fully vaccinated, there's still a chance that you can have a breakthrough infection, and there's a chance based on the viral load that you can pass it on to somebody that's immunocompromised, or it could also pass it on to somebody that isn't even eligible for the vaccine, i.e. our children. And then the CDC does recommend universal indoor masking for all teachers, staff, students, and visitors to K through 12, regardless of vaccination status. We've been sharing this with our superintendents, Adams 12 and Boulder Valley School Districts. The guidance came out last week. Some announcements went out. The state also updated their guidance. So those conversations continue with those districts. And as we get more information, we'll update this council. Next slide. So as far as what we're seeing in the state and here in Broomfield is that we're seeing an increase in cases. Statewide, 95% of the cases are the Delta variant. Hospitalizations are increasing in the state, and again, it's largely among the unvaccinated. And then we're seeing an increase in the number of PCR tests, so people that are going out and getting tested, in the 7-day percent positivity. You can see the same thing in Broomfield. We're in that elevated incidence rate. Most striking to me is just, again, how transmissible this is. So the last time we gave an update to council was on July 19th, and you can see our case rate was 36.7 at that point in time. As of today, we're at 98.9 cases per 100,000. So jumped up significantly, and same with our percent positivity. Where we're seeing our case rates that are the highest are in that 20 to 59-year-old age range, which is similar to the state, and also in our 0 to 11-year-olds, which is obviously concerning because they're not eligible for the vaccine yet. We did have 5 hospitalizations from July 17th to July 31st. So that is an increase for us. And unfortunately, we had 1 additional death. And then you can see where we are as far as vaccine status. Again, thankfully, out of our eligible population, we have a high vaccination rate. And then when you look at the total population, we're at 66.4, which is still extremely high in the state and across the nation. Next slide. So this just gives you an idea of where we're seeing the increase in cases. So it breaks it down, and what's circled is where we saw the highest number of cases by month. And so in May, it was within the 20 to 29 and 30 to 39 age group. In June, we saw it in our 12 to 19 and in our 20 to 29 age group. Now what we're seeing is pretty much across the board a increase in cases in all ages. So we'll again continue to track that, and I'll talk a little bit more about what that means, because we're primarily assuming this is happening in our unvaccinated population versus our vaccinated population when I talk about breakthrough cases. Next slide. So I know our hope was not to create panic out there, but given the CDC announced their new metrics for what is substantial or high transmission, we thought it was important to the public just to show this new metric. This is not us changing the goalposts or moving the goalposts. Again, what this is just from a case perspective, acknowledging this is what the CDC is recommending. And as I mentioned clearly before, this graph will not drive what we do as far as policy decisions, solely case rates. But it is a little bit concerning to see our trending up and potentially moving into that high transmission rate if we remain on the same trajectory. Next slide. This is the measure we have been tracking, though, which is our severity metric. And with those additional hospitalizations, you could see that we have now increased to 0.41% as far as our 14-day moving average of our hospitalization rate. So we're still not near where we were with the November and December peak. And we're not where we were early on in the pandemic, but we are starting to see that hospitalizations are creeping up, which again is a little bit more concerning, but we're not at risk of enacting snapback measures, which is capacity limits, social distancing, all of those pieces at this point in time. Next slide. As far as our vaccine breakthrough cases in Broomfield, and remember, this is over time. This isn't just with the Delta variant. Out of our 46,998 Broomfield residents who've completed vaccines or been fully vaccinated, only 73 have been identified as a breakthrough case. And none of those have resulted in hospitalizations and deaths. That's good news right now. What we've talked about are these are numbers we're going to continue to track as a local public health agency, because now as we talk about cases, hospitalizations, and deaths, we think it's important to track those that are happening in the unvaccinated and those that are happening among our fully vaccinated, just to get a picture to see if those breakthrough cases are start to increase over time and we start to see a trend. And again, as we mentioned before, as you have more and more people that are vaccinated, given vaccine effectiveness is never 100% effective, you expect to see more breakthrough cases. And you can see the breakdown by age groups.
Jason, can I just ask a quick question on this? So what percent is that? I was trying to figure out the formula for, what percentage is 73 out of 46,988?
Yeah. Great question, Guyleen. I'll have the team run the number and then we'll follow up.
Thank you.
I'm math off the top of my head.
Okay.
Next slide, Jake. And then the last thing I just want to show is at this point, our modeling data doesn't show that there's a threat to us exceeding hospital capacity, but the modeling team also now has to incorporate a lot of this new research that came out from the CDC. That being said, what this graph shows is that where we would be at if we stayed on our current trajectory of vaccinations versus if we were able to reach our 80% vaccination rate. And what you could just see is that leads to a significant number of reduced hospitalizations across the state, which again, that's our ultimate goal, reduce hospitalizations and reduce deaths. Next slide. And then lastly, that as far from a policy update, Broomfield will remain in level clear until August 16th. All the metro counties are weighing that with the severity metric and determining if they plan to let their public health order expire or if they plan to continue it, and no final decision has been made. Additionally, the governor announced over the weekend that he's extended the statewide public health order. I should say, actually, CDPHE did. And it's extended through September 1st. So face coverings are required for those that are 12 plus older individuals who are not fully vaccinated in specific settings. And these are those congregate settings, prisons, homeless shelters, and healthcare. But their public health order does not address schools. They do recommend, and we are recommending mask wearing in all other indoor public settings. Again, it's just a recommendation. And lastly, what I talked about before, we'll just continue to watch those severity metrics. And next slide. I think that might be the last one. So with that, that concludes my presentation, and we're happy to open it up to questions from council members to start. And again, the general public, we encourage you to use the Q&A chat function to enter in your questions, and our team members will respond to those as well. So any council members with questions? Councilmember Schaaf, we'll start with you.
Thank you, Jason, and thank you for the presentation. So I'm going to start off with one of the more recent things you mentioned, which was the CDC metrics that you put in there. And if we were to look at those metrics, we would be in that high transmission, or we would be on the verge of that high transmission. And so you were saying that we aren't necessarily going to, change our metrics or change our policies based on that. So I guess my question is that, the new Delta variant is in essence a new virus. I mean, it acts very different than that Alpha or the original COVID-19. So should we be changing our metrics, and should we be adapting our policies for this new variant?
Yeah, thanks, Councilmember Schaaf. As I mentioned before, we'll continue to watch those case rates in those metrics, but at this point in time, we don't think that warrants us changing our mitigation or policy strategies. And the reason for that is, again, we see the vaccine is still highly effective with the Delta variant against severe illness, hospitalizations, and deaths. And that's what we want to see. But this is our warning light. When you're driving your car and you start to see that warning light going off that says you need to get your oil fixed or transmission or whatever it is, we have a warning light going off with our case rates to say you need to be aware and watch case transmission and see what that looks like and see how high that goes, because we all know that hospitalizations and deaths are a lagging measure. So if we start to see those increase in Broomfield, we'll definitely be watching that. The other thing we'll be watching more closely, Councilmember Schaaf, too, is specifically outbreak data. And if we start to see this translate into some of those vulnerable populations, that would be something else that we would be extremely concerned about and bringing back to our Board of Health and Council. For example, if we started to see it take off in our long-term care facilities.
All right. Well, thank you for that. So in terms of the, are we changing any recommendations for large indoor or outdoor events, or council meetings, committee meetings, community meetings, or any, considering at this point any type of universal mask policy?
So at this point, we're not, Councilmember Schaaf. Our hope is, again, with this recommendation, that we'll see the public follow it. Again, if you think about it, those individuals that are vaccinated, again, masks are recommended because it's one additional mitigation measure, but the reason we didn't go to a full requirement is because we know those number of breakthrough cases at this point in time are not to a point that they're proportionately high where we have to say we have to put an order in place. So we're asking people to just follow our recommendation and be aware of it. And the main point behind that is, again, if you are somebody that's fully vaccinated, we just want you to be aware from a public health perspective that you could potentially be a breakthrough case. And if you are, there's a potential that you can pass it along to somebody who's immunocompromised or somebody else that, a young child that's not eligible for the vaccine yet.
Thank you for that. So I have one more question, and it has to do with the asymptomatic, which is kind of what you were talking just about now. Has that perspective changed from the original, original COVID-19, the Alpha versus the Delta? I mean, the asymptomatic numbers and trends, is that shifted at all, or are we still kind of in that same realm of about the same amount of population as it can be asymptomatic in transmitting this?
Yeah, thanks, Councilmember Schaaf. I'm going to let Dr. Urbina take that, 'cause he dove into the research as far as what they saw with viral loads and symptomatic and asymptomatic information from the Delta variant.
Thank you, Jason, and thank you for the question, Councilmember. Early on, we didn't know. And honestly, the vaccine was so new. We had not a whole lot of people vaccinated. So if you remember, we were still talking about still wearing your mask, still taking the protection, not being in large group gatherings. Now we know, after watching the vaccine, we now know that we're certainly exposed to the earlier alpha variant and some of the earlier variants that we saw circulating before, that there was largely a asymptomatic spread of the infection, and it was not very many of them. Now we know over a period of time, with particularly the Delta variant, that we're seeing that in the study that Jason talked about in Massachusetts, that people that had gotten the Delta variant and had previously been vaccinated had the same amount or higher viral loads. So that's the number of viral particles in your respiratory system that you could potentially spread. So that whether or not they were symptomatic or asymptomatic. Increasingly, we're seeing people with mild symptoms associated with the Delta variant, not necessarily asymptomatic. They just may not know. They would not be severely ill, hospitalized, and the good news is they won't die from it, but they're mildly symptomatic, and we're starting to see those trends. And that's what the data shows right now, Council Member, but stay tuned. We're following very actively all these cases in those congregate care shelters, nursing homes, healthcare workers. So we're learning more as we go along, but that's our current data and our current information.
So mildly symptomatic, runny nose, cough, etc. And should we be getting tested at that point with those mild symptoms?
Great question. I forgot to say that. Great question. Yes, if you've been exposed, even though you've been vaccinated, and you should definitely get tested. So that's part of our recommendations. And as we do our epi follow-ups led by Helene, we're recommending that folks, if they've been exposed and are out there, even though they've been vaccinated, to get tested, just like we did before. Although it's rare, we still think that they could be spreading the illness. And that's very important. Thank you for asking that question.
That's all I have, Jason. Thank you.
Thanks, Councilmember Schaaf. Councilmember Anderson.
Thank you. I did get a text. One of our residents, Judy Kelly, would like to ask a question, but her chat is disabled. I'm not sure if it's an IT question, if there's any way to fix that. Otherwise, I will have her maybe send the question, text it, and I can ask it here shortly. But yes, see if there's a way she can ask. So I'll start with some of the questions that I have been asked about the school districts, and I do see there's a couple of questions in the chat that these are very similar to. One of the biggest concerns right now is what we as parents should expect, because I'm still like other parents here. We have the unvaccinated children, and we really want our kids back in school. I think the majority of us really we need our kids back in school, and yet parents need to not just feel safe, but know that their kids are going to be safe. And you did note that the case rate was highest with the 0 to 11 as one of the two categories, and most likely because they're unvaccinated. I think it'd be helpful to, a couple of questions here, and I'll let you answer them together, is what are we seeing in these, as we're seeing these case rates increase for these 0 to 11-year-olds? Is it anything to be concerned about? Are these super mild? It's okay if these kids get the virus, or is it critical? And then also, and this is like, we know that when we go back to these elementary school and preschool populations, the majority of the teachers might be vaccinated, but all of the kids are going to be unvaccinated. And so that guidance piece says there's a concern. Now, this is a moving target, I guess I would call it, because Adams 12, we were doing well. Broomfield put out guidance in the past, and maybe that guidance led to Adams 12 making a decision that, masks are optional. And I don't even know where, not sure where Boulder Valley School District is in this, but, so they put the recommendation out, and now things are changing with the Delta variant, and now the guidance is changing. So I'm not sure if you had conversations with some of the superintendents and health officials there, if they're changing their guidance or if they're sticking with their guidance, and is it really a concern for that 0 to 11 population as far as the seriousness of the condition? I guess those would be some of the first questions. Thank you.
Yeah, thanks, Councilmember Anderson, and definitely so. Obviously, as school districts are under a lot of pressure to release information because they have schools opening, and this information all came out late last week, which obviously they did have a significant amount of time to digest and take into consideration. I have been texting Chris Godowski all day to say we'd love to chat again, and he's open to the idea. So Helene, Dr. Urbina, and I will be joining him for another call. And Helene and Dr. Urbina have also been working very closely with Boulder Valley School Districts and St. Vrain on their recommendations. The challenge with this right now is ultimately it's a Board of Education decision. It's not, unfortunately, a public health decision as far as whether or not they do this. The only way that would change is if Broomfield Public Health decided to enact a mask order for those 18 and under. And that would have to be a policy discussion with the Board of Health. I would say the challenge with that is if Boulder potentially went that direction and Broomfield did, but Adams 12 didn't, or say Tri-County didn't, then we have students that live in, they're going to Adams 12, and on one side of one county, there's no mask mandate, and on the other there is. So that's one conversation that complicates this that we're continuing to walk through with the districts. As far as the what we're seeing and the potential risks to kids with the Delta variant, I'll turn that over to Helene and Dr. Urbina to address that.
Go ahead, Helene, since you haven't spoken yet, and then I'll follow up if need to.
Something we're continuing to watch. We're definitely paying attention to some of the uptick we've seen in some other states and that have made reference to some children having very mild and some children having more severe. So we're going to continue to watch it. It's definitely part of the conversations that we're trying to just make sure schools are, and childcare centers as well. So we're working with all the childcare centers too, in terms of just trying to help them be prepared. And we're always bringing back in those layered mitigation conversations in terms of the ventilation, the hand washing, having the hand sanitizer, all those things that we've been doing, but to some degree, maybe some people have let up a little bit, and trying to make sure we're incorporating all of that as we continue to watch the data. And Dr. Urbina, please feel free to share any other points.
No, I think that for the parents out there, I think Helene and Jason are right on. And obviously, if you're vaccine eligible, you should get your vaccine. For not only your child that's 12 and older, but also all members of your household. And then the layers that Helene talked about, I just wanted to add a couple to that. Masking, obviously, in the schools, indoor settings is very important. But if you're sick, you should stay home. And get tested, whether or not it's going to be influenza, RSV, or COVID-19, because we really want to limit the spread of the infection in not only at home, but also in the school settings. So increasing ventilations, all the schools have said, we're going to increase our ventilation. We're going to work with our local public health agency like us here in Broomfield to isolate those that are sick with COVID-19 and quarantine those in high risk exposures. Now that's the challenge, is that we've got a lot of pushback last year from people that were very worried about taking their kids out of school. So I think if we go forward with increasing vaccinations, we do all the layering that Helene has talked about, and we really take, as a community, protect our kids and our families, I think we can have a very safe school year, and we'll be working with the school districts to make that happen.
Thank you. And I guess that brings back the question of if we could get a quick update on where in the process, how soon do we anticipate approval for vaccinations for kids under 12? Do we have any update on that?
Yeah, Councilmember, we had hoped that it would be September, October, but now it looks like the recent data, the FDA and ACIP have all said they want more data. They want more kids in those age groups to show it's both effective and safe. So that's some of the delay. I wish I had a magic ball that says, oh, it's going to be X date, but now it looks like a late fall, early winter before we have that information. But we still could put in all these layers of protection that we talked about while we're waiting to hear more about those vaccine eligible kids from 5 to 12.
Okay, thank you. And then just a quick comment is, as parents, we will have to make that decision. I, of course, can send my student to school, so I'm a 10-year-old to school with his mask on and it gets tougher when not all the kids are wearing it, but it'll be interesting to see, how many parents actually voluntarily have their kids wearing that mask for that extra layer of protection. And I appreciate the note on the increased air ventilation. I guess if that's a question it's going to vary by school. So is that a question maybe for a school, for the individual school that parents should be asking what type of ventilation are they using? Because that could greatly increase their protection. And then the last question I have, and I don't even know if this is a question. I know that there's, HOAs and other entities that are looking for any guidance on, when they should, what they should with the masks, and it becomes that it's a recommendation. So it's really up to that, the store, or the HOA, or the fitness center to put that in place. Is that correct? So they can do it if they want to, and highly recommended.
That's correct. Yeah.
Okay.
If they want, that's our recommendation, and it's up to businesses, HOAs, others, if they want to follow it or enact something stronger.
Okay. Thank you. That was all my questions.
Thanks, Councilmember Anderson. Councilmember Lim.
I have questions at both ends of the age spectrum, I guess. So I'll start with the older age group that's more vulnerable. Do we have any information that was, I guess it would have had to been voluntarily given to us, about the staff vaccination rates at our long-term care facilities? I was a little dismayed to see a national report with, I think it was like 56% of the staff at long-term care facilities have received their full vaccinations. And I thought, oh, I hope ours are better than that. Do we have that data?
Yeah, let me start, and then I'll turn it over to Helene, because I just actually posed this question to the state. The one area that keeps me up at night, obviously, is our long-term care facilities, especially with the potential for breakthrough cases. My question to the state was, are you looking to enact any type of order that would require vaccinations in those facilities that they license? At this point, they haven't made a commitment. They're exploring that. But secondly, then my question was, do we have the legal authority locally to do something like that? So if we wanted to enact a public health order that our licensed or long-term care facilities had to require vaccinations, that would be something that we could do. And again, other than the route we've been talking about of, recommending vaccines, that's the one area that obviously is concerning to me. So that's being researched. At the same time, I know that they're moving towards having the long-term care facilities report their vaccination rates by facility. So Helene, do you want to comment on that and what we're hearing in Broomfield with our specific partners who have done a great job throughout all of this?
Sure, and we continue to meet with them at least once a week, just in terms of just how that support looks, just as an FYI. And I'm happy to share that because of that partnership that we have with them, we know right off the top of our head in terms of all of ours have an excellent ratings in terms of staff vaccinated, fully vaccinated. So it's actually in the upper 95% plus for all of our facilities. One of our facilities actually is setting, and I don't know if it's gone into effect yet or it's very soon actually, that it will be required for their staff. So we are really proud of the work that the long-term care facilities, so that's the assisted livings and the skilled nursing facilities in our county are doing. So they are doing a great job. They do have a lot of requirements set by both the state CDPHE from HCPF. So at a federal level, there's requirements. So and CMS and with Medicaid, and so there are a variety of things they must meet, and whichever one is stricter, that's the one they must follow. And so we work with them really closely.
Okay, that's great. Thank you. I'm glad to hear that. That's, yeah, I'm glad we're doing much better than the national statistic on that. With the younger populations, with the students going back to school, I guess back to that Massachusetts study, since that's what the CDC is using to look at the transmission of the virus by those who have been vaccinated. Is there any reason to think that that would differ in children than in adults? Did that study look at all the age groups?
Yeah, Dr. Urbina, you want to take that one?
Sure, happy to. That study did not, because it looked at a pocket of folks in a long-term care facility. There are ongoing studies, and that's one of the nice things about the CDC, because we're able to monitor cohorts, and Jason referred to this earlier, cohorts of people, college students, people in long-term care facilities, healthcare workers. Now we're monitoring all of those folks to see what the virus is doing to those populations. Fortunately, we haven't had as many cases in the school settings in younger people. That evidence that we're still watching very carefully. And as Jason alluded to earlier, we're watching those numbers, and the state and the CDC is looking at those school-age populations very carefully to see how it's spread, what the contagiousness of the illness is. But it looks like, at least the preliminary data, even the young people are probably spreading the new Delta variant in the same contagiousness as older people, the same high amount of viral load, the same amount of spread of the illness. So the good news is that they are generally mild, but that means we should still protect them because we don't know the long-term effects. There are children who get seriously ill. The multi-inflammatory syndrome in children. We've had in the country over 400 deaths in children related to COVID-19. So it's not it's always a mild disease. Still important to do the layering that we've talked about before in this discussion.
Okay, then that is my question. Then if we don't think the transmission is any less severe in children, then why would a school district go to a policy where it's not requiring a quarantine unless there's an outbreak greater than 5 students?
Yeah, Councilmember.
And then I'm also looking at, I'm thinking, they're not going to require quarantine if there's an outbreak greater than 5 students. And then what if there's multiple outbreaks with 3 students each. Does that not require a quarantine? I mean, I don't get the volume there of 5. What's significant about that? And can't it spread with less than 5 in an outbreak?
Yeah, I'll start with the high level, and Helene's our school expert, so she can answer the specific question. So the school districts were working off of the CDPHE guidance that was released prior to all of this new information coming out from CDC. So they were putting, again, a lot of these measures, plans, everything in place. And this announcement hit late last week. Again, we're having those conversations and a follow-up conversation specifically with Superintendent Gadowski and also Superintendent Anderson around what are the specific quarantine rules. Helene, I'll turn it over to you to talk about Councilmember Lynn's question of why the 5, and then specifically, can you address, did CDPHE change their school guidance based on the new information for the Delta variant?
It's a tough question, so good question. And it's definitely something we're all talking about pretty heavily, both, we work within our team, we work with the other neighboring county LPHAs as well. So I guess the overarching, what I would say is that, as Jason shared earlier, we plan to still revisit this and meet with Adams 12 again. That is definitely something we want to address further with them, because there are nuances to quarantine that maybe not as clear to, like household contacts, and there's certain things that we do have to be very careful of, and it may not have come as clearly through on that. But CDPHE did change the number 5 is just it used to be 2, and then we kind of bumped it up to 5, just kind of looking at like the size of a school and where does that land. But because of the Delta variant, we are all constantly kind of dealing with kind of updates on a daily basis. So I think that this is still ongoing. I know that the schools are very eager to let parents know what the school year will look like, and everyone's intent is to keep in-person learning. Everyone's intent is to keep kids safe, staff safe. And so I think that's partly why we want to revisit, the mask question mark in terms of where do we go with that in order to make sure we can keep that in-person learning. And the quarantine number, wherever that number lands, or an outbreak status lands, it's still something that it's very much in the weeds of figuring out, like, is it one classroom? Is a sports team? Is it a choir class? Where there's so many nuances that it's something we're still kind of hashing out as and we'll be working on as the school year goes on. I don't know if that helps hopefully, but
Yes, it does help to know that it's still, being discussed. I mean, I understand if I don't have children in that school at school age anymore, but I would be concerned seeing those plans as they came out late last week. So thank you.
You're welcome, Councilmember Lim. And I would just say one other thing that we're seeing with the school districts is it's become a place of contention between them all, because if each district has a different policy, ultimately it's the parents deciding where they want their kids to go. So you have some parents that are totally opposed to the idea of having kids wear masks in schools. And we know we have a surrounding county next to us on our northern border where they can opt out and go to that district. And then you have others that feel very strongly that students should be wearing masks. And so we keep providing the public health recommendation, but it gets extremely complex when you talk about each district having to do this on their own. It would be a lot easier if we had more of a statewide centralized system. Great. Do we have any other questions from council members? Doesn't look like it. Deb, was there anything in the chat that you wanted to bring up or highlight?
Yeah, Jason, there are a couple of questions that we answered, and you can see those in the answered tab where we typed in answers, but I left a couple in that we could discuss briefly in our remaining time. So Mara chatted in a couple questions related to the schools, and I think we addressed part of the question just in terms of the ongoing discussions with Adams 12. But one of the questions that she asked, and it's a good one, is, with the state extending the mask order, just recently for another 30 days for specific populations, unvaccinated individuals in prisons, homeless shelters, healthcare settings, why were schools not included? And, my presumption, I think, is that, the state is really wanting to turn some of these decisions over to the local level, reflecting just the, variances in terms of level of transmission at different levels. But do you have any additional insights, Jason, beyond what I just said that we could share?
I wish I did. I know that the state, with their school guidance, stakeholdered it with parents, with superintendents, with public health. And ultimately, that's what led to the release of that guidance. So I'm sure they heard from very diverse perspectives across the state around the need for this. And we know we have some of our counties and other areas of the state that are strongly opposed to the idea of having masks. That being said, I appreciate the question. And again, I don't want it to appear or sound like Superintendent Godowski was going against the recommendation at all. Our conversations with Superintendent Godowski were early in the week. We had this released, and that's hence why when CDPHE released new information on Friday, I've reached out to him and said we'd just like to have a follow-up call with you to discuss further. And I would just say last year, throughout the pandemic, he was very data-driven, very concerned about the health and safety of his staff and his students. So we look forward to that follow-up conversation with him.
Thanks, Jason. And Mara, I don't know the specific answer to your question of number of kids in schools versus prison. If someone on my team does and wants to chat it in, great. Otherwise, we may have to follow up on that. But your other remaining question I thought might be worth chatting about for a minute. And so Mara's asking, would outdoor learning environments present any health risks in respect to COVID or other impacts? So thinking about, promoting outdoor learning environments. And so I don't know, Helene, if you have any insights in terms of how outdoor and learning environments have been brought into the conversations locally. And certainly I think Dr. Urbina can chime in as well as in terms of risks of indoor versus outdoor.
Well, I'd like to chime in first, Helene, if you don't mind.
No problem.
Now, clearly, anytime you have a well-ventilated area like outdoor settings, the risk of transmission of any virus, including COVID-19, is less. So I think if we can encourage that when it's obviously warmer and we can protect the kids from getting sunburned, then I think that's all good. Now, however, in the winter, obviously, and that's where we were most concerned, as kids start to congregate indoors and they don't have as much abilities to get outdoors, and I think we're more concerned about that. So we're going to have, as Jason and Helene and Deb have talked about before, we're going to have ongoing conversations with the schools to try to increase the ventilation, to try to make sure that our kids are as safe as possible so they can stay in school. So I think that as we get more news about the vaccine and younger kids, hopefully all of those will all hit at the same time and we'll protect our kids more effectively. But yes, outdoor settings are more safe than indoor settings.
And I'll just add, that's part of our current conversations, and it's especially been prevalent with our childcare programs as well as summer programs. So definitely encouraging anything that we can, what can be done outside, if it's a dance recital or if it's an event or whatever, we're definitely trying to encourage that. But we also have to be preparing for what the late fall, winter, when weather kind of will change. So it's definitely in the planning conversations.
And I think the other part that she was getting at was, then if we are doing things outside, what additional, protections do we need to, whether that's sunscreen or whether that's, I don't know, that's what I was also thinking and ensuring that's part of the conversation too, right?
Yeah, we definitely bring that into all conversations. How can you enhance all public health protections, not just from COVID? Councilmember Anderson, I saw you had an additional question.
Thank you. I was just thinking back to the COVID testing last year. We went from the waiting in lines to dedicated test centers, and then ultimately some of the schools started sending home in-home test kits. I forget the name of the company that they were doing those with. Are those, as far as COVID testing going into this next school year, are those in-home test kits, are those effective for the Delta variant? Does it matter which variant? Is it effective across all of them? Is that sort of the recommended, like just a couple thoughts on that testing process if we do have kids that we think are exposed or just thank you.
Great question. Helene, you want to take that since you've been working with the schools on testing, but also just the question around the Delta variant and the accuracy of those tests?
Sure. So we do expect the in-home tests to continue, and we do hopefully by middle or end of this week, we're also expecting an announcement from CDPHE on more clarity of what the school testing options will be. So there will be information being sent to the superintendents, and whether that looks like, a vendor like kind of COVID check looked or something that the school helps control, that's definitely going to be a picture of this. The state is really advocating for the importance of whether it's surveillance testing or some type of ongoing testing, as well as the community testing centers that we know will continue throughout the year. So all of that is critical. And just to piggyback to something at the beginning of our conversation, if someone is vaccinated and exposed, CDC actually did just change their recommendation that even if they're asymptomatic, they should be tested on day 3 to 5. So we really want to continue to make sure that message is out there, even if you're vaccinated and asymptomatic, to still get tested if you were exposed to COVID. And so we still want to make sure there's access to testing. So that again, we're continuing to plan that within the health departments and the schools. Specific to Delta variant, the state has heavily promoted the Binax now, tends to be one of the main ones, but there are some other at-home options. But we definitely at this time feel confident in identifying any of the variants. It's more sensitive when someone's symptomatic, but we still have confidence in all of those tests, and we'll continue to study and watch it, because as we know, the virus can kind of keep evolving. So that will be more information that we'll study as well.
Hey, Helene, before we wrap up, can you also address, because I'm sure the question will come up, what are the quarantine recommendations now if you're fully vaccinated with this new Delta variant research?
So if you're fully vaccinated, meaning it has to be 2 weeks post whether you got the single dose or if it's the 2 doses after the 2 weeks after the second dose, if you're fully vaccinated, you don't need to quarantine. There are some nuances to that in terms of if it were like a household exposure, for example, a parent is vaccinated, but a child is testing positive, it's often harder to really kind of stay quarantined and so separated in the household. And so there is some nuances there to kind of sometimes tease out of a situation. But in general, at this time, we're saying that if someone's fully vaccinated, they don't need to quarantine, but they should be watching for symptoms. And same thing, what I just said about if they've been exposed, then they should really be seeking out that confirmation testing, day 3 to day 5 after exposure.
So yeah, thanks, Helene. I appreciate you addressing that. And I know we're running over time, but just one thing I do want to say is I understand from the public's perspective having to go through this pandemic, and you're dealing with changing guidance, changing information, and I'm sure it's frustrating for us all. That being said, we are going to continue to follow what the research and the literature says, and I'm just always amazed at the level of questions that we get from our council members and our mayor on this call of how educated you are on the topic. We were discussing some of the slides to include if they're too complex or not, and I said, No, they're not extra complex for our council members. They're on top of this and get it. So we will continue to be very transparent, update you, update the community. I saw there was a question if we're going to share this recording. Yes, we are planning actually to start promoting these recordings, not only through our social media outlets, but including them in our community updates and our emails to council. So our hope is to get this detailed information out to the public so they can get the deeper dive on all of this.
Well, I just wanted to say thank you for having this call. I've been talking to a lot of residents. As you can see, there's lots of concerns with this new information, but I just got to remind myself that we are battle tested and we have been through this. So we will pivot and do what we need to get through this next. Thank you all for your vigilance.
Thank you, Mayor. I appreciate that. And again, let's be cautious now, but we don't have to be extremely alarmed. So that's the message I want to get out to the public. With that, I thank everybody for your time. It's great to see you all again.
Thank you, PH
Thanks.
team. See you later.
Thank you, everyone.
Thank you.